Indonesia is the world's fourth most populous country, but when it comes to coronavirus, it has received very little attention. That could be about to change. The country looks vulnerable because of poor infrastructure and a fractious balance between religion and politics in the world's largest Muslim-majority nation. Indonesia reported its first COVID-19 infection at the start of March. Now it has one of the highest mortality rates in the world. However, the scale of the outbreak could be vastly underestimated because the country has only tested a limited number of people. Compared to South Korea, the poster child of effective testing in Asia, that is nowhere near enough. Medical professionals say Indonesia's healthcare system is completely unprepared for a pandemic, with a vast shortage in intensive care unit beds and ventilators. But a fundamental threat to Indonesia's coronavirus response is also political. One of President Joko Widodo's biggest political vulnerabilities is the persistent and false accusation that he is anti-Muslim. That weakness has come under pressure amid coronavirus. In May, 20 million migrant workers would normally have left the big cities for their hometowns and villages in an annual migration known as Mudik that follows the Islamic fasting month of Ramadan. In late April, Jokowi, as the president is known, banned the annual migration. But analysts say he moved too late, given hundreds of thousands have already embarked on the journey home. Their departures have raised the risk of spreading the disease to remote areas where healthcare systems are particularly weak. Jokowi still says a national shutdown would be incompatible with local culture. China's failure to stop the Lunar New Year migration in January has been blamed at least in part for the initial spread of the disease. Whether Indonesia has stopped its own migration early enough could determine if Southeast Asia's largest economy is heading towards a humanitarian disaster.